Anatomy of the stomach. The stomach is attached above to the lower end of the esophagus and below to the duodenum. It acts as a reservoir for food and helps in digestion of carbohydrates, proteins, and fats. Location. It lies in the upper left part of the abdomen, that is, the left hypochondrium, the epigastrium, and the umbilical area. The stomach is J-shaped in structure. External features of the stomach. The stomach has two orifices, two surfaces, two parts, and two curvatures. So the first one is two orifices or two openings. The stomach has the cardiac orifice and the pyloric orifice. The cardiac orifice is joined at the lower end of the esophagus. It lies at the T11 vertebrae. The pyloric orifice opens into duodenum and lies at the L1 vertebrae. Now let's see the two curvatures, that is the lesser curvature and the greater curvature of the stomach. The lesser curvature is concave and forms the right border. It is attached to the lesser omentum. It has an angular notch called as incisura angularis. The greater curvature is convex and forms the left border. It is attached to the greater omentum and the upper part has a cardiac notch. Now let's see the two parts of the stomach. So the stomach has the cardiac part and the pylorus part. So first let's see the fundus. In the fundus, it lies in the upper part. It is filled with gas. The body lies between the fundus and the pyloric region. It contains three types of cells: the mucous cells, the peptic cells which contains enzymes, and the parietal cells which secrete HCl. The pyloric or the pyloric antrum is separated from the pyloric canal by sulcus intermedius. The pyloric canal terminates into the pylorus. Interior of the stomach. The mucosa of the stomach is made up of folds called as the rugae. The lesser curvature has longitudinal rugae called as the gastric canal. It is vulnerable to peptic ulcers. Relations of the stomach. Peritoneal relations. Peritoneum covers the anterior and the posterior surfaces along the greater curvature. They join to form the greater omentum and the lesser omentum along the peptic ulcers. Lesser curvature. Near the fundus, it forms the gastrosplenic ligament. Near the cardiac end, it forms the gastrophrenic ligament. Bare area of the stomach includes the peritoneal reflections of the greater and the lesser curvature. The left crus of the diaphragm is attached posteriorly to the stomach. Visceral relations of the stomach. The anterior surface is attached to the liver, the diaphragm, the transverse colon, and the abdominal wall. The posterior surface forms the stomach bed. The structures in the stomach bed which are separated by the lesser sac are the left crus of the diaphragm, the left kidney, the left suprarenal glands, the spleen, splenic artery from celiac trunk, pancreas, transverse mesocolon, splenic flexure of the colon. Blood supply of the stomach. The greater curvature is supplied by the left and the right gastroepibloic artery and the gastroduodenal artery. The lesser curvature is supplied by the left gastric artery from the celiac trunk and the right gastric artery from the hepatic artery. The fundus is supplied by the short gastric arteries from the splenic arteries. Venous supply of the stomach. The veins which supply the stomach are the portal vein, the splenic vein, and the superior mesenteric veins. The right and the left gastric veins drain into the portal vein. The right gastroepibloic vein drains into the superior mesenteric veins, and the left gastroepibloic vein plus the short gastric veins drain into the splenic veins. Lymphatic drainage of the stomach. The upper 1/3 drains into the pancreatic splenic nodes. The lower 1/3 left drains into right gastroepiploic nodes. The right 2/3 drains into the left gastric nodes, and the pyloric part drains into various nodes. For example, the pyloric, the hepatic, the left gastric nodes. Finally, they all drain into the celiac nodes. Nerve supply of the stomach is done by the sympathetic nerves and the parasympathetic nerves. The sympathetic nerves are derived from the celiac plexus and the hepatic plexus. They help in transmitting pain. Parasympathetic nerves are derived from vagus nerve. Applied anatomy of the stomach. Vagotomy is the surgical removal of the vagus nerve to reduce secretion of the acid in the stomach. Gastric ulcers is seen in the lesser curvature of the stomach, especially in people who eat spicy food. Gastric carcinoma is seen in the greater curvature of the stomach. Pyloric obstruction causes vomiting after meals. Partial gastrectomy is removal of stomach.